Hey, everybody. Welcome back to the Beat podcast here at Vive in Los Angeles. Today, I have the privilege of hosting Dr. Scott Schell on the podcast. Dr. Schell is an accomplished senior executive, surgeon, and healthcare futurist with over 30 years of experience spanning the healthcare, biotech, and technology sectors, both in the U.S. and globally. His leadership roles have included CEO, CMO, chair, director, and executive consultant, and he brings an extensive background that includes healthcare delivery and operations, pharma, med devices, clinical trials, and data science. Such a pleasure to have you here on the podcast, Scott.
Hey, Saul. It's just such a pleasure to be here with you today, and I really look forward to our conversation.
Definitely look forward to it as well. First of all, I just want to say I'm impressed with your background, the different things that you've done. Even coming into the podcast room today, you noticed some of the audio. I mean, you're kind of a jack of all trades guy.
Well, it's very kind. It's interesting because the pandemic has really taught us about paying better attention to presence, both digitally and physically. And so background noise can be really, really super annoying when you're trying to get a point across or learn something new, doesn't it?
Yeah, big time, big time. So Renaissance man you are. I want to jump into some of these questions. How do you see digital transformation reshaping healthcare delivery in 2024? And what are the main challenges and opportunities this presents?
It's a great question. I have the privilege of being able to speak to healthcare C-suite, IT leaders, and business line owners in organizations ranging in size and complexity from single hospitals and regions to IDFS systems. And every single one of those individuals is really very highly focused on the concept of digital transformation, and most of them are really well underway. Last year, we did a provider automation survey where we engaged 300 of exactly these kinds of individuals and looked at outcomes as related to workforce effectiveness and financial success. And it's interesting because fully a third identified call center operations, care management, patient access, and patient financial services as their greatest automation opportunities. And as I look at that, that really is about digital experience for the patient, which is, I think, the moment that we're facing. And really the objectives around the patient experience then devolve down to things that center on satisfaction, health outcomes, productivity of the care providers. And particularly, I think solutions that optimize call center operations, clarify and streamline the patient's interaction with their financial experiences, and really overall improve their ability to access, schedule, and obtain health care services, I think are really spot on in importance for every health system. There's no question that patients are confused and increasingly angry about healthcare cost, billing, transparency, and payment systems. And all of those were clearly reflected in the survey data by leaders in each of the three tiers that I talked about. And so therefore, I think call center automation and patient financial services tools become increasingly important. So the question is, from my perspective, is this an area where health systems should be focusing? And I think emphatically yes. And I think the healthcare organizations agree with at least half of those that we surveyed and are currently engaged with, really actively moving down the line in these areas.
Yeah, thank you for that. And I think it's really great, Dr. Schell, that you honed in on the patient and really in a day where consumerism is so important in healthcare, more than ever. So we know digital transformation projects don't always go smoothly. What specific complaints and struggles do you hear about how patient experience projects can go wrong?
I think it's a really important question, Saul, and I think it's important also at the beginning to drill down to make sure that we're talking about it from the perspective of the systems that are deploying these projects versus the patient's perspectives of their impact on their experience. So we at Cognizant live in the area of the systems and the technology, so let's spend some time hovering on that. Again, the survey that we did provided some very interesting insights, and cost overruns were the number one complaint, although I suspect that this is primarily an issue during first implementations. And here's why. Projects change scope, organizations gain practical insights about what IT and manpower assets are actually required for deployment. Next, health system leaders really, really want to have useful analytics to inform them about strategic and operational pivots, and digital transformation and automation systems can provide massive amounts of data. And so that means that automated, integrated analytics are just completely essential for success. And adding these analytics and actually being certain what they are is typically a process and evolution. So adding additional analytics and reporting capabilities drives costs as well. The third complaint really, I think, focuses upon return on investments, because all of these projects are undertaken with the goal of, if we do this, then our efficiencies or revenues, et cetera, will improve. And people need to think and be mindful that there's a lag between deployment and actually realizing these returns. And so calculating that expected lag into ROI makes people feel more at ease about early returns and feedback. And then after cost and implementation and analytics, we talk about barriers to implementation, staff training, change management, complexities related to implementation that limits the system capabilities really round out the rest of the most frequent concerns.
Some really good ones that you point out there, Dr. Schell. And with AI and machine learning, big buzzwords in healthcare, what ways do you see these technologies having a tangible effect on both providers and patients?
Right. Well, we all have been completely inundated with ChatGPT and AI and transformational change opportunities and threats to our existential reality. And I've had hundreds of conversations over the past 2 years specifically about these topics. There's no question that it's taken society, healthcare, technology, daily life completely by storm. Until a few weeks ago, I used to joke that there's going to be AI in my laundry detergent. And then I went to a big box store and saw that the electric toothbrush and the vacuum cleaner were now AI powered. I'm not exactly sure what that means, but somehow I have in my mind that there's some nagging critic similar to my mother who's going to say, you're not doing it right.
That is too funny.
Every single healthcare executive I know is focused on AI, and every health system that we interact with has a plan and a budget specifically for AI investment. And while their specifics aren't fully formed, the killer app is perceived as one that dramatically improves operations and outcomes in whatever context they're currently struggling. I think health systems have some real significant opportunities to use AI in its various forms to augment the patient experience. We and others in the marketplace are deploying AI tools to help patients access benefits, payments, and cost information. And that harkens back to the first question. Gen AI, I think, is particularly helpful in augmenting call center interactions because it provides real-time, insightful summaries and answers related to the patient's history, their journey through the system, and suggesting for improving their outcomes and providing them a solution to the problem that they present with. And then I think another significant area is AI enhancing the prior authorization process, which you know involves specific patient information, plan and regulatory data, and sometimes local regional requirements as well. And so we see tools now that really optimize this and decrease the inborn errors that happen when human processing happens. I think AI has an important role in digital transformation in healthcare. We're all, I think, focused on and worried about having solutions that don't make decisions that can hurt patient care. But along the continuum of AI, which includes machine learning and robotic process automation, all the way up to the generative solutions and large language models, I think there are solutions that can meet many of the needs that are confounding health systems in their journey today.
That's a really thorough summary and certainly great tangible impacts that these technologies could bring healthcare, both providers and patients. Are there any pitfalls in regards to Gen AI? You did mention Gen AI in your response that patient experience leaders should watch out for.
So the concept of AI hallucination, where the Gen AI model gets it wrong, is appropriately terrifying for caregivers. No one wants to have an input or a decision-making aid or tool that acts autonomously that results in the injury of a patient. Mm-hmm. And so all of those types of models now are in pilot or proof of concept roles or are finally adjudicated by a live human clinician before being implemented or released. However, if you look at it, these concerns really aren't as relevant if you look at AI related to digital transformation that focuses on the patient experience, because you're not talking about just-in-time clinical decision-making. Demographic, utilization, financially, scheduling data, these are generally accurate and contemporaneous. And so once an AI system has been properly trained on that system, the risks for errors or AI hallucinations are actually quite low. The key really is getting the essential robust training pool of data. And without that, you'll introduce bias. And we've seen that in some of the public-facing systems where AI systems are listening to themselves and then repeating stuff which is compounded in their errors. And this is going to be another area where health systems and providers have to focus because their data pools are traditionally fragmented and poorly organized. And if we look at some of our largest system providers, they're very, very heavily focused on data harmonization and quality improvement, which is going to be a years-long process.
Yeah, well, thank you for that. There's certainly, like you said, real-time clinical decision support where some of the concern is, but then the day-to-day things where big value could be added. For those organizations that haven't started with their digital transformation projects yet, either with or without AI, do you have any tips to help them make a strong start?
Sure. The first is a recognition that automation initiatives can cover massive portions of operational and strategic landscapes. Some deployments can be entirely standalone, and others require technology change and integration to infrastructures, APIs, and the AI tools that you're using. So my key comment there is focus first on identifying the most important functional solution that your system needs. Second, find the technology solutions to those specific problems and the business partners with whom you can work to deployment. Third, focus on the change management. Everybody talks about change management, but people are averse to the concept of a change in their day-to-day. And I think they're fearful in some cases about the automation technologies replacing their roles. In fact, what you're doing is you're freeing them from repetitive work to bring them to the top of their training and their capabilities. The organizations that I've worked with that have seemed to have gotten it right the first time institutionalize this by establishing an internal center of excellence or a leadership team that's accountable to supervise the automation process. It's really important to clearly define your goals and objectives with KPIs that this leadership team can own and then send forward into the organization for their leaders to adopt and champion. Again, work with partners who can maximize the benefit of the technology, both from an integration and deployment standpoint, and also importantly, I think, manage the often transient staffing requirements and the costs that are associated. If you're a hospital system, it makes no sense to hire 500 IT specialists who you know are going to be there for 9 to 12 months. And then measure the project, the timeline, the goals, and the costs, and their KPIs all the way to their conclusion. Because by doing that, you can avoid cost overruns. You can take care of the inevitable changes and enhancements that you now recognize because you're in flight with the efficiency that goes along of having all of those teams and assets in place and don't have to come back and rework it later.
Some really great points there. And folks, hit rewind on this one because Dr. Schell really offered some big value points on that response. That's the beauty of podcasts. You could listen on demand. So hit rewind if you need to take some notes on that one. But also in the show notes, we'll leave a summary of the discussion that we had here today with Dr. Schell. Dr. Schell, what closing thought would you leave people with? And what's the best place they could reach out and learn more about you and Cognizant?
Fantastic. Well, Saul, let me say again how much fun it's been here to spend time with you and talk about this today. I think the one takeaway message that I'd like to leave your listeners with is that I think automation tools ranging across the spectrum of what's available now, up to and including Gen A, are perfect tools to consider in doing what we talked about in the last question. That is unloading a lot of repetitive manual work and raising staff's time and input to the last mile. I think that's important because staff are overworked and feeling burned out. And I think we all recognize that the economy and staff pressures are troubling every healthcare institution. So I think these tools really can drive change there and avoid a lot of the pitfalls that we've talked about. Cognizant is always available for you to reach out, and you can reach out to me directly, and I'll be happy to chat with you or connect you with some of my associates who can find the right pathway for your particular needs and solution. And thanks again so much for making the time for us to talk.
It's our pleasure, Scott. Really appreciate you and looking forward to our next chat.